Welcome back to the Better Health Now podcast. Today I sit down and talk with Lauren Stone, a nurse practitioner here at Cullman Regional. Thank you so much for joining me.
Thank you for having me.
So before we dive into the topic of prenatal visit, I want to talk a little bit about your background prior to coming to Cullman. So talk a little bit about where you would ultimately pursue a nursing degree at and how your journey to Cullman kind of happened.
Sure. So starting out, I always knew that I wanted to work in healthcare in some form. That led me to nursing school, which I went to UAB for undergrad. And there I had several clinicals. I really fell in love with women's health in general, specifically labor and delivery at that time. Okay. So my first job was at UAB in labor and delivery. I worked there for a little over 5 years. I loved that. I loved the relationships that I built with women while they were in labor, getting to be there for really exciting parts of their lives, and then also getting to be there to support women who were there for some of the worst parts of their lives. So I really enjoyed that. I did know that I wanted to be kind of a bigger part of their care and follow them more outside of just that small area of time.
Yeah.
So that led me to pursuing my master's degree.
Okay.
And I went back to UAB for that while I was working. Got a master's in nursing, specifically with women's health. So continued to work a little bit after that, and then began working in some of the high-risk OB clinics at UAB as a nurse practitioner. That was such a great experience. I saw some incredible things there and learned from other providers that, it was just an amazing experience. I then was given the opportunity to come shadow Dr. Massengill here at Cullman Regional. I'm from Cullman originally. Well, I moved to Cullman when I was in high school.
Okay.
Graduated from here, so this is home to me. My husband and his family are also from here, so we knew and had kind of been hoping and praying for things to eventually lead me back to Cullman. And when I came here and shadowed and met, the clinic staff, patients, everyone that I would be working with, I just fell in love with it.
Yeah.
So I agreed to come here. I think it was the best decision made yet. So I've been here for almost a year now working, and I've loved it.
Yeah. So diving into the conversation of the prenatal visit and what that experience would look like for a potential patient, what does that, the patient has that positive pregnancy test, what does that first sort of encounter with a physician look like?
Yeah. So I feel like this is where a lot of stress kind of comes in right off the bat. Having been someone in those shoes, right when you get that positive test, there are usually a lot of emotions involved. And the first question is, where do I go from here? So the answer is pretty simple. Typically, you just call and set up an appointment with the provider that you're hoping to see for your pregnancy. From there, given your last period, usually they can give you a timeline for when you need to come in.
Okay.
So typically that's going to be around 8 weeks. So we can do an ultrasound and see your baby, give you a due date, know how far along you are. And then after you have that ultrasound, usually you have just kind of a general exam with your provider, getting things up to date if you haven't had an annual exam, and kind of just talking through those first expectations with your pregnancy.
So I know that at Cullman Regional, y'all also give the expecting mother a book for like that journey and what they could expect to see over the course of the pregnancy. What does that book sort of entail, and how does this sort of educate the patient on their journey over the next 9 months?
So I actually have one with me. It's very well made. So the book kind of details a lot of what we can go through today, but it starts with introducing the providers that we have here, and then has a phone number for any questions that patients may have, especially after hours on there. It has a timeline of visits, so you kind of know what to expect for how often you're coming back, the big things that are going to be happening along the way of your pregnancy. It also has a list of pregnancy-safe medications for over-the-counter issues such as colds, things along those lines, and a list of foods to avoid. So it has a lot of good information in there for, first, second plus times moms, so they can go through here and kind of have that very easily accessible. And we do also have a card that has a digital copy of that. So
yeah, and so they had the positive pregnancy test. What is those first 2 visits, and is the ultrasound that first 8 week? Is the 8 week period that first visit for them, or do they have a few visits up until that ultrasound?
So usually that's going to be the first visit for them. So generally the first thing that we like to do is see them and have that ultrasound to confirm that there is a pregnancy, and then kind of move forward from there. There are some special cases, with everything where a patient may be seen a little sooner than that if they have things that would make them high risk in their pregnancy. But just for a general healthy patient, that's usually the timeline for that. So after that first visit, they'll typically come in and meet with some of our nursing staff. At that visit, they'll have blood work done, and they will kind of go through a lot of what's involved in this book, details with pregnancy, prenatal visits, what to expect. They'll have a little more one-on-one time at that appointment to go through their expectations.
Yeah, and then so from that the first appointment, they get the ultrasound. What does the process look like over that the second and third trimester of them then having, I would assume the cadence of their appointments shorten between how frequent they actually are.
Exactly. And again, this can vary based on medical conditions that the patient has, but generally we see patients, around that 8 week mark, and then for the lab visit, and then monthly. And that leads up to the third trimester, or at 28 weeks. Generally, those visits just involve coming in, listening to the baby, measuring the fundal height, which kind of tells us if the baby's growing appropriately. And then talking through any concerns that the patient has, common symptoms for that point in their pregnancy, things along those lines. After that point, when you reach the 28-week mark, it does kind of change as far as the timeline of your visits. So after 28 weeks, generally we go to every 2-week visits until 36 weeks, and then it's weekly until the time of delivery.
And so, and I would assume there's also some testing that y'all are doing along the way for certain, things that could happen during pregnancy, diabetes, or whatever that might look like. So what would the experience be as far as the other tests that would be involved in that maybe 28-week onward portion of their visits?
So aside from the initial lab work that we do, 24 to 28 weeks is what's recommended as a timeline for testing for gestational diabetes. So that generally involves a woman coming in, doing a drink that they drink, and we test their blood sugar an hour later after that. Depending on if they pass or fail that, they will either be cleared as not having gestational diabetes, or if the test has failed, they will repeat that in a 3-hour form. Other than that, testing is typically done again at around 36 weeks. At that point, we do a swab that checks for a bacteria called Group B strep, which is something that we kind of go more in detail with the patient about, and that would be most of the blood work that we do, aside from general infection testing.
Yeah. So, I mean, you've been a part of a lot of patients' journeys on them having their children. I mean, over the years working at UAB, working here in Cullman, is there a question or something that comes up in conversations that you see unanimously across the board that patients typically always come in and they ask this question? It could be at the beginning when they're first finding out, or it could be later on in the journey.
So there are a few. There are questions about, just what to expect with their pregnancy in general, questions about what to expect with feeling their baby move, and then questions about, I would say the most common one is the mom coming in and saying, I don't really know what a contraction feels like. I've heard several different things. Maybe it's their first baby, or they just, for whatever reason, didn't fill them with past pregnancies, but those would be the most common ones, and those are great times that we can kind of revisit what to expect with what you're feeling in pregnancy, symptoms to be concerned about, and times that you should seek more care.
And so, and with that book that you give the patients, besides just the journey of their appointments and what to expect at different levels within that 9-month period, I would assume there's other information as far as like dietary things and other things to kind of avoid. Talk a little bit about kind of what what other information besides just the appointments that we've discussed is kind of present in the pamphlets that you give out?
So there is a page on foods to avoid that is kind of right here in the middle of the book. It's along with medications to avoid. Generally, these are things that we go over in one of those first 2 visits as well. But it's nice to have this as kind of a reminder as a patient, especially medications. That's something that we touch on very early on, so we can make sure that anything that they're taking is pregnancy safe. Aside from those, on the last page, there is a list of things that patients should call the doctor about. So these are very general things, like if you think your water breaks, if you're bleeding like a period or heavier, the typical things that we kind of remind patients of at each visit. But there are things that aren't as black and white. And any questions like that, there is always someone on call who the patient could call and talk to and kind of see, what they could do at home to alleviate those symptoms, or if they need to come in and be seen at the hospital.
Yeah, and that level of communication between, the nurse practitioners, the doctors during that 9-month period is important, and it kind of creates that sense of security as far as what this journey is going to look like. Because even if it's your first, or if it's your third or fourth, every I would assume is a little bit different.
Oh, absolutely. Yes. And I think that's, one of the biggest things when it comes to pregnancy is creating an environment where a patient not only feels comfortable in the care that they're receiving, but comfortable asking questions.
Yeah.
It's super common for a patient to come in and say, this is a dumb question, but But I mean, even working in healthcare, myself being pregnant, I have Googled things and, had some strange questions too, because pregnancy is a very different time in your life. So I always want patients to feel comfortable coming in and asking us those questions.
Yeah. So with the name of the podcast being the Better Health Now podcast, what does that statement of Better Health Now mean to you?
Yeah. So kind of going from what we were just talking about, I think the biggest thing is just empowering women to feel comfortable and confident in their care, and knowing that, we are all human. If there is anything that they are not sure about, I don't ever want anyone to guess. I want them to feel comfortable coming to one of the providers and, talking to us about any concerns that they're having, and just feeling confident that they are receiving the best care possible.
Yeah. Well, I appreciate you taking the last little bit talking about the prenatal visits for patients. Hopefully that kind of informs them more of what this journey would look like for them. We'll have information in the episode notes. If you want to find out more information about Cullman Regional, you can just visit that. But I thank you for taking the time to talk with me today.
Absolutely. Thank you so much.